long. I think I know probably most of you, but if you don't know me, my name is Ted Groshong from the class of 1967. And, oh, thank you. These guys are impressed I lasted that long. No, I'm kidding. Anyway, I am a pediatric nephrologist, and Dr. Churchill has been kind enough to make me the Associate Dean for Alumni Affairs. I'm very pleased that you all could come here. This is an absolutely fantastic. You should know that this is the largest dinner that we've ever had for these alumni dinners. So congratulations, you guys. And before we go further, though, I think it's really important to recognize the people who actually do the work. And Alex and Charles, who else? Rich, who else did all the work? Laura, would you guys please stand up? And they do a terrific job. I have the pleasure of introducing the award presenters this evening. The first of them is Dr. Robert Churchill, who is the Hugh E. and Sarah D. Stevenson Dean, and Gwilym S. Lodwick and Maria Antonio Lodwick Distinguished Professor in Radiology at the University of Missouri School of Medicine. And he doesn't write all that out himself. He has somebody else do that. Since becoming the dean in 2009, Dr. Churchill has launched a comprehensive effort to improve quality, to transport graduate medical education, and he's done a tremendous job with that. Advanced biomedical and translational research, and he's focused on improving our diversity and our cultural competency among our students, among our faculty, and in our school. Dr. Churchill previously led the Department of Radiology in the medical school. He was chair for over 20 years. He arrived in 1987, and I had the privilege of being one of the people who interviewed him. And I should say that I probably immediately after interviewing him, I went to our dean, Dr. Mike Whitcomb, and I said, Dr. Whitcomb, you need to hire this guy. And Dr. Whitcomb said, as only Dr. Whitcomb would, yes, I know. And so he didn't need me anyway. After 3 years, he was served as a school's vice dean. He was interim dean. He was interim vice chancellor and chief executive officer for MU's Health Sciences Center until 2000, where he returned to the Department of Radiology. In addition to leading the medical school, he has done a fantastic job in his department. And I think anyone who has had a chance to just sort of objectively look at the academic department's radiology is just fantastic. He has totally built up a wonderful residency program and actually a superb educational program, particularly in the area of nanomedicine. As dean, Dr. Churchill oversees the medical school's approximately 650 faculty. Okay, now I want you, back in 1904 when I was a student here, we probably had no more than 100 faculty. Dr. Goldberg is here. Dr. Goldberg, did we have more than 100 faculty? Huh? 99 faculty. Anyway, we now have 650. 1,500 staff members, 1,000 students, that is medical students, graduate students, residents, postdoctoral fellows, clinical fellows, and other students with advanced degrees. He's also responsible for our practice plan, which is the University of Physicians, which has the 440 plus faculty physicians that we have at our medical school. And in addition, our 7,300 physician alumni, such as the people who are in this room. In 2004, our Medical School Alumni Association presented him with an honorary Medical Alumni Award. The second person I get to introduce is Dr. Leonard Polite. Dr. Polite is president of our Medical School Alumni Organization. He's a member of the class of 1962. I had the privilege of having him be my chief resident when I was a medical student, and he was the guy we always wanted to grow up and be like. He received MU, that is the whole campus Distinguished Service Award, which is the highest award honor that can be given by the MU campus for an alumnus. He was the first cardiologist in private practice at Boone Cardiology. He's an early leader in cardiac catheterization and pacemaker implementation in mid-Missouri. He retired from private practice in 1999 and then turned right around and came to the university, and he is now teaching cardiology fellows as a clinical professor at MU. He graduated #1 in his class in the School of Medicine, did residencies in pathology and internal medicine, cardiology. He also was on the also in the military and served in Vietnam, where he received a Distinguished Service Award from the Vietnamese military, as well as the Army's Commendation Medal. He served on the MU Steering Committee for all we call Mizzou campaign, raising over $1 billion for MU. He's a member of the Mizzou Flagship Council, chair of the Chancellor's Residence Preservation Committee, past president of the Medical School Foundation, distinguished fellow of the Jefferson Club, a member of the, well, I think I give up. It's a pleasure for me to present our dean and Dr. Leonard Polite. And let me just mention, before I do that, that all the people being honored, we'd like to have you come over to my left, that is to your right, and then come across the stage this way, or I will be in deep trouble. Thank you.
Thank you, Ted. As we all know, Ted is the icon of University of Missouri, and I don't know that anybody knows more students that's come through this place than Ted, and more students have had the admiration of his teaching. At this time, I think we really do need to, it's a wonderful meal, wasn't it? And I think we'd like Chef Darrell and his staff, if they would come forth, and let's give them a hand for a great meal. See, we have this in 3 years again here, so I hope we'll come back to the same place. We're honored this evening to really see the products of the University of Missouri School of Medicine, and I think the recipients tonight really epitomizes the quality of students and their achievements that they have done. I'm not looking forward to the nominating committee next year's for the recipients, because I think they've really outdone themselves this year. We, our first, I would like to, our first honorary medical alumni award will go to a person, Dr. Sarah Walker. And of course, everybody knows her. We call her Sarah because she's just a dear friend and really a tremendous contributor to the university. She was the professor of medicine, and now is medicine professor emeritus, past president of the American College of Physicians, senior scientific advisor for the Missouri University Institute for Clinical and Translational Science. If you'll bear with me, I've got many more things to say about her, okay? She is internationally recognized rheumatologist. Sarah has significantly advanced medicine understanding of autoimmune diseases, especially that of lupus and arthritis. And her investigationals found a link between certain hormones of lupus, a disease much more common in women than in men. She's been co-investigator and significant supporter of the Missouri Arthritis Rehabilitation Research and Training Center, and a federally funded center to disseminate information to the public about arthritis education and strategies of minimizing disability. Sarah grew up in Texas, Homestead, Texas, Hempstead, Texas, where her father practiced medicine for decades. She graduated from the University of Texas in Austin with honors, went on to the University of Texas Medical Branch in Galveston, where her father received his degree many years before. Graduating in 1964, she continued her training in Philadelphia General Hospital, and then returned back to Texas as a resident of internal medicine at Baylor College of Medicine, affiliated hospitals in Houston. She began her career in rheumatology in 1968 at the Rackham Arthritis Research Unit at the University of Michigan in Ann Arbor. Completed her fellowship supported by the National Institute of Arthritis and Metabolic Disease in 1980. Joined the medical faculty at the University of Missouri in 1980, and that's when we really got to know Sarah. She led immunology and rheumatology training programs, served as chief of rheumatology at the Truman Vet Hospital, and since retiring from full-time academic medicine in 2006, she has supported Missouri University in communicating its clinical and translational science affairs. Her research has received numerous awards from the National Institute of Health, Department of Veterans Affairs, U.S. Department of Education, author of many books, one of the first books to comprehensively evaluate the role of steroids in autoimmune rheumatic diseases. Written over 140 book chapters, reviews, articles, and on and on and on. She's been honored by the American College of Physicians Laureate Awards while serving as its organization governor for Missouri from 1991 to 1995. She became the American College of Physicians president in 2002, and in 2009 she was presented with the American College of Physicians Alfred Stingel Memorial Award. Dr. Walker, could you please come up and receive your honorary award? Sarah, you never had a few words to say. Okay.
No, I'm going to keep it down. Dr. Polite, thank you so much for the lovely presentation of this beautiful award. I thought that speech was written by my mother. I appreciate it so much. Thank you. And it's a joy to be here and to see so many wonderful friends in the audience. I'd like to, if I might, briefly introduce my guests. Dr. Jerry Parker is here. He has been my colleague for 30 years. We have worked together, and he has allowed me to collaborate with him on his seminal studies of the importance of psychology and psychological aspects of rheumatic diseases, and he's known all over the world for this, and he's also a wonderful friend. I'd like to thank him and thank him for nominating me for this honor. Dr. James Cassidy and his wife Nan are here. I've known them. Jim was my teacher when I was a rheumatology fellow at the University of Michigan, and I'll always remember his wisdom and treasure their friendship. Now, the Mullins are here. Dr. Helen Braley Mullen and Dr. Ed Mullen are distinguished professors of the University of Missouri in our Division of Immunology and Rheumatology and the Department of Romance Languages. Dr. Helen Mullen, I can tell you, is a very brilliant and patient collaborator with me. Dr. David Fleming is at the same table, and I think everyone knows he's our new chair of medicine and also has assumed a very important role nationally with the American College of Physicians with his recent election to the Board of Governors. And this means that this gentleman will, for at least the next 5 years and probably longer, be a very important voice for medicine on the national scene, and we're delighted to see him. And finally, my good friend Dr. Ingram has joined us. It's a delight to see him again. And I was just reminding him that not only am I Professor Emeritus in Internal Medicine, but also adjunct in the Department of Pathology and Anatomic Sciences. And thank you very much for this lovely award.
Our second award goes to a person who I think everybody in the room knows quite well, Dr. Michael Hasakawa, a key architect of the innovative problem-based learning curriculum here at the University of Missouri, which this program, of course, has national recognition at this time. He retired from his role as the school associate dean for curriculum in 2009 after serving 17 years in the dean's office and 35 years at the University of Missouri. He continues contributions to Missouri University as a professor in the Department of Family and Community Medicine, where he was a leader in the faculty development and co-director of the fellowship program. Before joining the University of Missouri in 1974, he was an associate professor, a director of community health, and director of graduate research at the University of Oregon, while he received his doctorate in education. He helped develop Missouri University's nationally ranked family and community medicine department until the early 1990s, when he was called upon to initiate the problem-based learning curriculum. This has, of course, affected so many of our students and who've done so well under his tutelage. Today, the problem-based curriculum is internationally admired. It's helped medical students score far above their peers in national licensing exams and residency program directors' reviews. School leaders throughout the United States and abroad have visited the University of Missouri to learn about problem-based learning curriculum, which has become a hallmark of success at the university. He also, in addition to that, is a founder of Missouri University's highly acclaimed Rural Track program, which supports students from rural Missouri in becoming physicians in underserved communities. His other important innovations include Mini Medical School, which gives high school students a glimpse of medical school at the university and jump-starts a week-long preparation for students about to begin their first year of medical school. Code Blue, in which fourth-year medical students receive academic credits for tutoring first and second-year students, and the Senior Teacher Educational Partnership Program, in which the students learn the joys and challenges of aging by participating with seniors living independently in the community. Dr. Hosokawa has served as a member of the National Board of Medical Examiners, the Board of Association of Behavioral Science, Medical Education, the Board of Association of Advancement of Health, Education, and other organizations. He received the University of Missouri's Faculty Award in 1996. Last year, his colleagues and former students established a scholarship in his name to recognize his many contributions to the School of Medicine, its students, and future patients. Dr. Hosokawa, would you please come forward?
This is quite an award, and when Alex called and told me about the award, I didn't really have a very good idea what it was all about. So I walked down the hall to the display that shows the names of the previous honorees, and I thought, oh, there's a mistake. There are some very august individuals on that board, and I'm very, very proud and honored to join that group. I wish that we had room up here for about 40 faculty, many of them in my home department of family medicine, who really made that curriculum come true. They stepped forward and helped to plan and implement that curriculum. It's been a wonderful success and a wonderful adventure. I will have to tell you that about 15 years ago, the Smithsonian had an exhibit showing 5 centuries of the Hosokawa family. The Hosokawas were feudal lords. They had a small fiefdom in Japan. And it was interesting because in the descriptions of the leaders, it said that they were interested in medicine and education. There must be something to social genetics. They were also samurai, which may also explain some of my quirks. Anyway, this is a tremendous honor for me. It is really the alumni of this institution and your successes that make the medical school a success. I asked Amanda Swenson to join us tonight because she's the example of what we want to happen. She's a graduate of the problem-based learning curriculum. Now she's coming back as a fellow and will join the faculty. And so we're now beginning to build a cadre of faculty who graduated from this curriculum, and we're really proud to see that happen. Thank you very much.
Our next category is the Distinguished Service Award. And I think probably most of the people here have had a distinguished service to the University of Missouri School of Medicine. It's very difficult to pick out who to select for these awards. Our first Distinguished Service Award recipient is Michael Raley, a graduate of the class of 1976. He studied the health disparities of black Americans throughout the 30 years of his career. And in 2010, he became Associate Dean for Multicultural Affairs and Associate Professor of Family and Community Medicine at the St. Louis University School of Medicine. He previously served as Director of Research and Medical Service of the St. Louis County Department of Health. Dr. Raley is a native St. Louisan. He graduated from the St. Louis College of Pharmacy in 1972. After graduating from the University of Missouri School of Medicine, Dr. Raley completed specialty training in family medicine at the University of Florida in Gainesville. He volunteered for a year with the National Health Corps before moving on to community and group practice, which eventually led to a solo practice of medicine in 1964. A recurrent theme of Dr. Raley's life has been an interest in community service, family social issues, and education. In 1992, he began teaching medical students and resident physicians at the Family Medical Program at Forest Park Clinic or Hospital in St. Louis. This eventually led to a clinical appointment with St. Louis University School of Medicine, where he has served as director of the third-year training program for family medicine in the Department of Community and Family Medicine. Dr. Raley is a frequent speaker in areas of stress management, obesity, hypertension, health aging, spirituality, and everyday life, and he is published in the areas of obesity management and has written books, chapters, and journals, articles on our very serious problem of obesity. In 2008, he published a chapter in the book, Cultural Proficiency in Addressing Health Disparities, which calls on medical schools and organized medicine to form stronger partnerships for addressing diversity. Dr. Raley, now leading diversity at St. Louis University School of Medicine, we look forward to a new partnership Missouri University might form with that institution and others. Dr. Raley's other positions include service on the board of directors of the Maternal, Child, and Family Health Coalition in Metropolitan St. Louis, St. Louis School of College of Pharmacy, Alumni Association, and the St. Louis Academy of Family Physicians. He received his Pharmacy College Alumni Award for Community Services in 2008. Dr. Raley has indeed been a supporter of community activities and has contributed so much. Dr. Raley, would you please come forward?
Thank you very much. My table reminded me that there are 3 good basketball games on tonight, and to make sure that I keep my comments brief, so I'm going to do that. But I at least want to stop and first of all thank God. I am reminded that God has a sense of humor, and to take a person from my background and humble beginnings and give me an opportunity to be a physician and to do things I've done is just remarkable. If someone had told me that I would get the honor of getting an award like this from University of Missouri, I would have said, "You're crazy." So I really thank God. I thank my wife, who has supported me in everything that I have done. She has always been wise counsel to me, and the prayers of my mom right there, and my friends that have come to support me, and my mentor here who taught me how to protect myself from my first punch. I don't know if you remember that. I got my first belt promotion from Ellis. So, and thanks to the University of Missouri for giving me a chance to help my dream of being a doctor, because I was one of those kids that wanted a stethoscope from the time he was 4 or 5 years old. So thanks to the University of Missouri for giving me my chance, and thank you tonight for this honor.
Our second Distinguished Service Award recipient is Janet Rader. Janet graduated in the class of 1983. She's chair, and Jack A. and Elaine Kleiger, professor of OB/GYN at the Medical College of Wisconsin in Milwaukee. As department chair, she's leading the development of a women's health research program and a regional gynecological cancer program. Before joining the Medical College of Wisconsin in June 2009, Dr. Rader was professor of OB/GYN and genetics at Washington University School of Medicine, St. Louis. Her clinical specialties include chemotherapy, laparoscopic surgery, and robotic surgery for the treatment of cervical, ovarian, and endometrial cancer. Dr. Rader completed a residency in obstetrics and gynecology at Michael Reese Hospital and Medical Center in Chicago. She went on to complete a research fellowship in molecular genetics and cell biology at the University of Chicago Howard Hughes Medical Institute, followed by a fellowship in gynecological oncology at the Johns Hopkins University School of Medicine in Baltimore. Dr. Rader has devoted decades in developing novel therapies for treating ovarian and cervical cancer. Her studies have specifically targeted the understanding and identification of biomarkers for early detection and prevention. Since 1994, her research has received continuous funding from the National Institute of Health and the American Cancer Society, including several NIH R01 grants. Dr. Rader also serves on numerous national committees related to gynecological cancer, including the National Cancer Institute Gynecological Oncology Group Cancer Prevention and Control Committee, and the Gynecological Committee on Experimental Medicine, the NCI Cervical Cancer Task Force, Gynecological Cancer Scientific Steering Committee, and I can go on, and I will do so. She's written more than 140 peer-reviewed publications and more than 20 book chapters. Dr. Rader, would you please come forward?
I promise you only a few brief comments, but I do have a few things to say, actually. First, I'd like to thank Dean Churchill for my nomination for this quite distinguished alumni award, and for my family, who's been very supportive in my pursuit of an academic medicine career. Over the last few weeks, I've actually thought a lot about my experiences as a medical student at the University of Missouri, which has certainly molded my professional career. One such memory was actually being part of a medical team with Dr. Weinstein and Perry that would ultimately cure a young university student of metastatic testicular cancer. In fact, I can tell you he actually was cured, because last weekend I actually spent with him as his beloved KU team was knocked out of the second round of the NCAA playoffs. This may have been actually my first interest or passion in beginning oncology. However, as students in the early 80s, we would have been surprised to learn that peptic ulcers were caused by bacteria and cervical cancer by a virus, and that someday there would be a vaccine to prevent cancer. We were also naive to believe that infectious diseases would no longer cause significant morbidity, just as the HIV epidemic was beginning to take the lives of young people across the country. In 1983, Dr. Heisel, also a fellow Missourian and Johns Hopkins Hospital vice president, gave our commencement address. He talked about medicine's preoccupation with technology and its cost. He talked about medical services being measured and organized along profit lines, investing society's capital in areas which are most profitable as opposed to the areas of greatest need. And I think these problems, as we know, are still of top concern to Americans today, a quarter of a century later. Hopefully the steps of Congress this week will continue to work towards equitable and affordable health care for all. I feel that I've been extremely lucky for a career combining research, patient care, and teaching, and I look forward to my administrative challenges at the Medical College of Wisconsin, including I cannot forget to thank Missourians who actually paid for my medical education. And I think I've received an incredible education and an incredible opportunity. So thank you very much.
We now move on to our Distinguished Service Award recipients. And here again, I think these are extremely capable individuals and have contributed so much. Our first is Michael Lefevre. Michael graduated from class of 1979. He is at the present time professor and associate chair of the Family and Community Medicine at the University of Missouri School of Medicine. He served as Chief Medical Information Officer for the University of Missouri Healthcare, and he's completed a Family and Community Medicine residency, a master's degree program in public health, a Robert Wood Johnson Academic Family Medicine Fellowship at the University of Missouri. Since joining MU faculty in 1984, Dr. Lefevre has demonstrated outstanding leadership as a scholar, educator, clinician, policy expert, and a champion for electronic health records. Dr. Lefevre is one of 16 members of the United States Preventive Service Task Force and is one of the first and only Missouri University physician to receive such an appointment. He's also served as member of the 8th National Conference of Prevention, Detection, and Treatment of Hypertension for the National Heart, Lung, and Blood Institute. Dr. Lefevre has served on several key national committees, task force, and panels, including appointments with the Institute of Medicine, a committee on Gulf War and Health solvents panel, and American Academy and Family Physician Commission on clinical policies and research. As medical director of Missouri University's Family and Community Medicine Department, Michael oversees 8 practices here in the area, more than 80,000 annual outpatient visits annually, and since 2003 he's helped lead the electronic health record project for the University of Missouri Health System. He's also played a very key role in Missouri University's collaboration with Cerner Corporation to enhance the use of information technology to improve health care, especially care of patients with chronic diseases. As a clinician and an educator, he teaches students the full breadth of family medicine, including outpatient, inpatient, and obstetrics. In 2000, the Medical Student Affairs Council presented him with an Excellent in Education Award. And 6 years later, he received an Outstanding Lecturer Award and the Curriculum Board Teaching Excellent Award. I think these recognitions from students are extremely important and will be remembered forever. From 1992 to 1994, he served as co-chair of the Curriculum Design Committee and completely revised the first and second year medical school curriculum with the implementation of problem-based learning at the University of Missouri. Dr. Lefevre, would you please come forward?
So I have to say I didn't really think very much about having to say anything tonight, but on the way down they told me I had 20 minutes. And knowing that Mike Kosokow was going to speak, and he's a man of few words, I assumed that I had 40 minutes. So I don't really know about the basketball game thing. I don't know how that's going to work out. I am assuredly humbled to be up here. There have been a number of times in my career where I felt like I was in a group of who's who and who's he, and I was the who's he, and I feel like that tonight as people parade across here with incredible credentials, and I'm humbled to be included among them. I'm honored, certainly, to receive the award, and I'm actually most especially honored because it's an award from the Missouri alumni. I have, actually I've graduated from Missouri, I think 4 times now. I have an undergraduate degree in electrical engineering. I graduated from medical school. I I graduated from residency, and then I graduated with a Master's of Science in Public Health, and I'm willing to say that when I'm cut, I bleed black and gold. And so this is a particular honor to be included here. I have now 2 or 3 children have decided to pursue a career in medicine, and I profess to have had nothing to do with that at all, actually, sincerely. But when faced with that, I had, with absolutely no hesitancy, said, you need to go to MU because it's the best medical school around. And I believed that, and so I have now an M1 and a graduate of University of Missouri Medical School. I will introduce only one person tonight, my wife, Judy, who is, in fact, the wind beneath my wings. And I thank you very much for this honor.
We have also tonight an Outstanding Young Physician Award. The Outstanding Young Physician Award is presented to alumni 45 years old or younger, and I'm glad I don't certainly fall in that category anymore, who's distinguished themselves in medicine. This year, we recognize 2 physicians who are quickly becoming stars in their field. Our first Outstanding Young Physicians recipient is Heidi Schue, a graduate of the class of 1994. She presently is assistant professor and senior associate consultant of colon and rectal surgery at the Mayo College of Medicine in Rochester. After graduating summa cum laude from the University of Missouri School of Medicine, she completed a residency in general surgery and a fellowship in colorectal surgery at Mayo's Graduate School of Medicine. She spent 8 years as senior associate consultant for the Division of Colon and Rectal Surgery at the Mayo Clinic in Jacksonville, Florida, before joining the Mayo Clinic in Rochester in 2008. Her teaching and research interests include surgical techniques for the treatment of colon cancer, laparoscopic surgery of the colon, and surgery for fecal incontinence and pelvic floor dysfunction. She also has received grant funding as principal investigator for a study on staple transanal rectal resection in the treatment of obstructive defecation syndrome. She's also was principal investigator for a study on sacral nerve stimulation therapy for bowel control and fecal incontinence. She served as co-investigator for a study on altered gene expression in patients with colon cancer. She has shared her knowledge in presentation from Hong Kong to Honduras and across the United States. A fellow of the American College of Surgeons, she is the recipient of several awards, including the Missouri University Marion DeWeese Awards in General Surgery, Division of Vascular Surgery Award, Janet Glasgow Memorial Achievement Citation, and Missouri State Medical Association's Outstanding Achievement in the Study of Medicine Award. She's also received the Eugene Lane Fellowship from the Mayo Graduate School of Medicine. And at this time, could you please come forward?
You'd think that after giving multiple presentations in lots of different countries that it's easy to come up here and, talk to people. But my husband will tell you, usually after the start of a big presentation, I take a beta blocker just to settle myself down. If I don't, then I speak very fast, and it's difficult to understand. But clearly, I do thank the Alumni Association for this wonderful and humbling award. Coming from the Philippines, my family immigrating here, I would never have thought to be where I'm at today. Working with colleagues at the clinic allowed me to serve patients the way I want to serve my patients. And it is truly the education that I received from the University of Missouri, including my sister, who's also a graduate at the University of Missouri, that allowed me to be where I am today. Certainly, I'd like to thank my family for immigrating here, allowing me this privilege to come here. And certainly my husband, who knows exactly what I do at work, and when I come home, tired and irritated, he knows exactly what it means. But I do it for my daughter because she's the most important thing in my life today. And thank you for putting up with her, running around, grabbing people's legs today, and yelling and screaming. Thank you. Thank you so much.
Our second Outstanding Young Physician Award recipient is David Endis, a graduate of the class of 1992. He presently is Associate Professor of Medicine, Medical Microbiology and Immunology, as well as Chief and Fellowship Director of the Infectious Disease Section at the University of Wisconsin School of Medicine in Madison. He also completed an internal medicine residency, followed by an infectious disease fellowship at the University of Wisconsin. His postdoctoral research in antimicrobial pharmacodynamics and molecular biology and mycology was completed at the same institution. He then pursued additional training in molecular mycology at the Woods Hole Marine Biological Laboratory in Massachusetts. His lab focuses on the study of antimicrobial drug resistance. In the areas of antimicrobial pharmacodynamics, he has developed treatments that slow drug resistance. He explores how patients develop resistance on a molecular level. In the area of clinical mycology, Dr. Endis investigates the exposure-response relationships in drug resistance. This emphasis has led to the creation of large clinical mycology research groups, involvement in treatment and epidemiology trials, and the ability to rapidly translate discoveries to benefit patients. Dr. Endis' research has recently focused on fungal biofilm, a drug-resistant infection common in hospital patients. The results of his investigations are used by both the pharmaceutical companies and by regulatory agencies such as the Food and Drug Administration, the Clinical Laboratory Standards Institute, and the Centers of the Disease Control and Prevention. At the University of Wisconsin core antimicrobial pharmacodynamic testing facilities, which he's helped founded, researchers in major pharmaceutical companies, biotechnology groups, and other laboratories in developing preclinical compounds. His research has resulted in more than 100 articles published in peer-reviewed journals, 17 book chapters, and an invitation to present nationally and internationally. He's received numerous honors and awards and is active in many professional societies. In 2010, his success as a physician scientist resulted in his election to the American Society of Clinical Investigation. With this tremendous background at such an age, Dr. Andrews, would you please come forward?
Thank you very much. I'd first like to thank you for the label young. It's not so often anymore that I get to keep that label. But on a more serious note, I'm truly honored to be recognized amongst such an amazing cadre of physicians and physician scientists. And I know that all of us who've spent time at Missouri remember this time as a formative experience. And I also have many fond memories of numerous faculty and lifelong friends. But I'd just like to take a moment to acknowledge two mentors who I credit for, I think, the majority of the opportunities that I've had in my career so far. And the first actually isn't a faculty member, but is my dad, who's here with me tonight, who has and continues to serve as a life mentor when it comes to life balance and work ethic. And the second is actually a faculty member and is also here tonight and is the faculty member who, when I rotated at the time, I was one of those students who pretty much liked all of the rotations and wasn't quite sure what I wanted to do. But those of you who've gotten to either work with or see the work of Dale Everett it's easy to understand how one quickly wants to emulate this master clinician scientist. So thank you very much, Dale, for your mentorship at the time and continued mentorship. And again, thank you very much for this wonderful honor.
We come now to the part of the program that I think is always one of the most exciting, and especially so this evening because I take tremendous pleasure in presenting the Citation of Merit Award. The Citation of Merit Award is the highest honor presented by the medical school here at the University of Missouri to an alumni who has performed outstanding work in their field. And tonight we have a great recipient, and that recipient is Douglas Wood. Douglas, a 1977 magna cum laude graduate from the University of Missouri School of Medicine. He became internationally renowned leader in improving health care quality and policy. He was born right here in Columbia, Missouri. He left Missouri School of Medicine to complete training in internal medicine and cardiovascular disease at the Mayo Clinic College of Medicine, where he has remained throughout his career. He is now Medical Director of Quality Academy, Chair of the Division of Healthcare Policy and Research, a professor and consultant in cardiovascular disease, and former Vice Chair of the Department of Internal Medicine at Mayo. As Vice Chief of Medicine from 1993 to 2008, he helped lead one of the largest and most prestigious departments of medicine in the country, and perhaps the world. He held major responsibilities for overhaul management in the internal medicine practice and strategic and quality improvement planning for the department, which has nearly 600 faculty members, 350 residents and fellows. His research on healthcare delivery, economics, regulations, and efficiency places him in the forefront of increasing important field of medicine. He was a founding member of the Institute of Clinical Systems Integration in Minnesota, as well as the Cooperative Cardiovascular Project and to improve cardiac care in the Medicare program. He chaired the Coding and Nomenclature Committee of the American College of Cardiology. He's led the Evaluation and Management Work Group of the American Medical Association's Current Procedural Terminology, or the CPT, and a panel in developing new coding solutions and evaluation and management services for physicians. He's contributed to the structure of the 5th version of CPT and has edited the American College of Cardiology Guide in Reporting Physician Services. The United States Secretary of Health and Human Services, Tommy Thompson, appointed Dr. Wood to chair the Secretary's Advisory Committee on Regulatory Reform in 2002. The committee provided more than 250 recommendations to reduce regulatory burdens and to craft long solutions for the way the HHS conducts business to improve regulation processes. Dr. Wood chaired the Minnesota Medicare Carrier Advisory Committee for 10 years, has been a member of the Health and Human Service Practicing Physicians Advisory Council. He's testified to the Congress, Medicare Payment Advisory Commissions in matters of Medicare carrier performance and regulatory burdens. Minnesota Governor Tim Pawlenty appointed Dr. Wood to the State of Citizen Council on Health Care Costs in 2003. This group produced a vision for Minnesota health care and a series of recommendations to achieve this vision. Dr. Wood was responsible for leading the council's quality planning and producing a strategy map for health systems designed for the future. He subsequently was appointed to the Minnesota Medical Association Task Force on Healthcare Reform. He now serves on the Minnesota Quality Institute, a group responsible for creating the strategic framework for the healthcare reform in the state. Dr. Wood is also a trustee of the Minnesota Medical Association and chairs the Medical Practice and Planning Committee. He's a charter member of the Performance Measurement Advisory Council of the Joint Commission of Accreditation of Healthcare Organizations. He chaired the Cardiac Expert Panel of the JCHO, the National Committee for Quality Assurance, the American Medical Association group responsible for making performance measurements recommendations, the heart disease that would be useful in the care setting. He's had numerous recipient of numerous awards. He's a recipient of the numerous he was honored by the Status Health in Minnesota for his contributions to hospitals and improving the care of patients with myocardial infarctions. Dr. Wood's also been recognized by the American College of Cardiology with his Distinguished Service Award. He's received Mayo's Clinic Distinguished Career Award and a Distinguished Service Award from Mayo's Department of Internal Medicine. Dr. Wood, your effort to improve health care quality and policy serves as an example of excellence to the School of Medicine. Students, faculty, members, and alumni, would you please come forward?
Thank you, Dr. Polite. The hour is late, and so in the interest of brevity, let me just share a couple of observations. Unlike the others tonight who have achieved their career distinction in academic and research areas, as you can tell, mine have been mostly administrative. But I can tell you that there are two enduring images that stay with me every day as I deal with patients, and I still practice clinical cardiology, and as I work on delivery system problems. The first is an image of a preceptor of mine in Farmington, Minnesota, when I was a senior, Dr. Dennis Durker. I watched him sit on the side of a bed of a woman died with heart failure and planned how she wanted to manage the last days of her life. I learned a lot about being a physician then. And I remember the image of a young nurse sitting in a rocking chair tending to a sick infant. It would be my privilege later to meet that nurse as a senior surgical medical student, and later we would marry. And it is her inspiration and her care and her encouragement, along with that image of Dr. Durker, that remind me every day, in every encounter with every patient, and with every encounter with a legislator or a regulator who thinks they have a better way of solving healthcare problems in the country, that I know how to do it better, because I learned the one true thing at the University of Missouri Medical School, and that was the importance of remaining true to patient care. So those of you who have worked hard in your careers, the members of the Alumni Association, a stellar example standing to my left, those of you, members of the faculty, who share the vision of Dean Churchill about quality. There is only one thing. Without quality, you have nothing. I wish you the best of luck and success. And with your hard work, then I know that the University of Missouri will indeed achieve the vision that you have before you and will contribute many more graduates who will have many more stories of success. So, Dr. Polite, members of the Alumni Association, Dr. Churchill, members of the faculty, thank you for this recognition. I'm deeply humbled.
We'd like very much, after we finish here, if all the reward recipients could come forward and get a group picture. I think you'll all agree that we've had an outstanding group of people to be the recipients of these awards. And thank you to all the fellow alumni and supporters who've joined us this evening. For those of you who will be here in the morning, the meeting starts at 7 o'clock at the Renaissance St. Louis Hotel, and there will be breakfast at 6:30. Also, if you want breakfast at that time. Also, our alumni reception will be held tomorrow night from 5:30 to 7 o'clock at the hotel. Finally, I want to note that the Alumni Office has award nominations materials for next year's, and anybody interested in receiving some, please ask them. And finally, I hope all of you, to return to the University of Missouri homecoming, next October, the 22nd, 23rd. Unfortunately, I'm not going to be able to be there in the morning with you all, but Dr. Steve Smith will be chairing the session. And thank you all very much for coming. It's been a great evening.